Question 10. The following are recognized recognized side effect of amiodarone. Corneal opacity. True. Hepatitis. True. Nightmare. True. Pulmonary fibrosis. True. Pleural effusion. True. Thyrotoxicosis. True. G. All of the above. Yes, all of the above are side effects of what? Amiodarone. Amiodarone is antiarrhythmic. Is working on the ventricle and atrium, especially working the Kent bundle. Patient on question 11. Patient on amiodarone should be advised by what? What you advise patient taking amiodarone?
Avoid sun exposure.
Avoid sun exposure. Otherwise you will get photosensitivity. Avoid giving what? High oxygen during general anesthesia. If this patient taken amiodarone for long duration and he been subjected to general anesthesia and being given high dose oxygen, high percentage oxygen, he will develop acute pulmonary edema. These two advice, you should advise patient with what? Amiodarone. The following are causes of postural hypotension. By postural hypotension mean what? Decrease of systolic pressure on standing 20 and more millimeter mercury. The causes in this question MCQ: drug, for instance aldomet. True. Bleeding. True. Amyloidosis. True. Scheidegger syndrome. True. Diabetes with autonomic neuropathy involvement. True. Steroid therapy. No. Because steroid is causing hypertension, not postural hypotension. Yes. Question 13. All of the following considered to be a cause of labile hypertension. By labile hypertension mean hypertension in this day, tomorrow is normal. After tomorrow is hypertension, and so on. This is called labile hypertension. Hypertension return to normal, and then he get hypertension in few hours, in a few days after. Essential hypertension the first year. Yes, they do get labile hypertension. Steroid therapy, they do get hypertension, labile cause. Pheochromocytoma cause labile hypertension. Using the drug clonidine causing labile hypertension. The F is renal causes of hypertension. This is false, because renal cause of hypertension causing what? Severe hypertension. Question 14. Patient he got ischemic heart disease and got hypertension. The following antihypertensive drug should be given. A. Beta blocker. True? True? Patient got ischemic heart disease or he got hypertension.
True.
It should be treated by the following drug. True or not? Beta blocker. Calcium channel blocker. True. None of the above. All of the above. All of the above. True. Patient asthmatic and he got hypertension. The following drug are good for him. Arabs. True. Calcium channel blocker.
True.
AC inhibitor. No. Beta blocker. No. Healing diuretic is no, because it causes more dehydration and more asthma. Okay. Asthmatic patient should not be received or given AC inhibitor because it causes cough and bronchospasm also, and beta blocker causes bronchospasm. Patient he got depression and he got hypertension. How you treat? MCQ. A. Beta blocker. No. Aldomet. No. Reserpine. No. Clonidine. No. Because all these are working centrally and making depression worse. While if AC inhibitors can be given, yes, Arabs can be given, calcium channel blocker can be given, diuretic also can be given to a depressed patient. Patient with psoriasis and he got a hypertension. A treatment should include ACE inhibitors. True or false? False. Beta blocker. False, because both of these are causing exacerbation of the psoriasis state. Exacerbate of the disease. Can give in other antihypertensive. True. Patient with hypertension, he got severe constipation, should be treated by the following drug. ACE inhibitor. False, because it causes constipation. Diuretic. False, because it causes constipation. Calcium channel blocker. False, because it causes constipation. While you give him beta blocker or aldomate, is quite good for him because it causes diarrhea. بعد التصوير. Questions. The following statements are true regarding church stress syndrome. It is a rare disease. True. 60% of patients have asthma. True. Eosinophilia in the blood seen in more than 10% of cases. True. It reaching 50% of cases. From 10 to 50% of cases. May present with PO. Yes, true. May present with weight loss. Yes, true. Asthma in church stress syndrome is a late onset asthma. Late type of onset asthma. True. Pulmonary infiltrate. True. All true. All true. Regarding metformin, the following statements are true. A. We use this drug as a first drug in diabetes type 2. True. Metformin used as a first drug in diabetic type 2. Yes, true. Metformin, we use it in type 2 diabetes if there is overweight only. This is false. You give metformin in type 2 diabetes whatever the weight. Overweight, hyperweight, normal weight, you can give metformin free. Metformin can be used with all anti-diabetic orally except insulin. This is false. Can be given with insulin and with all anti-diabetic oral hypoglycemic agent. Metformin can be used in type 1 diabetes on insulin if the patient is obese. Yes, true. No.